Welcome to this tutorial on the NIH Public Access Policy and Compliance Requirements. My name is Karen McElfresh, and I'm the Temporary Tracks Librarian at the Health Sciences Library. This tutorial is divided into 4 sections: Introduction and NIH Public Access Policy Basics, How to Comply, 3 steps, Managing Compliance with MyNCBI, and Delegates. Feel free to skip to the section you are most interested in. In this section, we'll take a look at the NIH Public Access Policy. We'll break down the policy and look at the who, what, where, when, and why of the policy. And we'll look at the recent changes in compliance efforts that went into effect in July 2013. This is the official language of the policy. It says that all investigators funded by the NIH must submit their final peer-reviewed manuscripts into PubMed Central upon acceptance for publication, so that they can be made publicly available no later than 12 months after publication. So basically, it's saying that all journal articles resulting from NIH-funded research must be made available to the public. Now let's dig into the statement a little further. We'll start by looking at who is affected by this policy. This policy affects anyone with an NIH grant or cooperative agreement active in fiscal year 2008 or later, anyone with an NIH contract signed on or after April 7, 2008, anyone who is part of the NIH intramural program, and all NIH employees. What does this policy cover? The policy applies only to peer-reviewed journal articles. It does not apply to other things in journals that are not peer-reviewed, such as letters to the editor, book reviews, or review articles. It also does not apply to books, book chapters, or dissertations, or to journal submissions that are rejected. The policy went into effect on April 7, 2008, and only applies to articles accepted for publication on or after this date. And finally, the policy only applies to articles that are the result of direct NIH support. At this point, I want to clarify some confusing terminology. The policy asks you to submit the final peer-reviewed manuscript, which is the final version of the manuscript with all of the revisions from the peer review process. This is the author's copy of the article, and it is usually a Microsoft Word file. The final published article is the formatted PDF that the journal posts on its website. Authors generally do not have the rights to this version of the article, so they cannot submit this version to PubMed Central without permission from the publisher. The final peer-reviewed manuscript is all that is required to be submitted, so make sure you keep track of these files. Where do articles need to be made available? According to the policy, articles need to be made available in PubMed Central, which is also called PMC. I want to clarify another area of confusion. PubMed Central is not the same thing as PubMed. PubMed is a database of over 22 million citations and abstracts from the biomedical and scientific literature. PubMed itself does not contain any full-text articles, but rather links you to the library's journal subscription to get to the article. In contrast, PubMed Central is an archive or repository of full-text articles from the biomedical and scientific literature. There is some overlap between PMC and PubMed, but just because something is in PubMed does not mean it is in PMC. To make things extra confusing, there are also different ID numbers for each one of these systems. If we have an article in PubMed, it gets a PMID, and then if it is also in PMC, it also gets a PMC ID. The PMC ID is the number that the NIH is interested in. Depending on the submission method used, there is also this third system called the NIH Manuscript Submission System, or NIMS. This system is used to submit papers, which will then be processed and deposited in PMC. We'll talk more about this system in the How to Comply section of this tutorial. When do you need to do this? The policy states that articles need to be made publicly available within 12 months of publication. This is the official date of publication, which is whenever the journal issue comes out, either in print or electronic. EPUB ahead of print does not count towards the 12 months. This 12-month timeline is another cause for confusion. It does not mean you can wait for 12 months to submit your publications. The submission should be done as soon as you get accepted for publication, because all submission tasks need to be completed within 3 months of publication. If you have to cite a published paper on your progress report and it has not yet been submitted, it will come back as non-compliant even if 12 months have not yet passed since publication. And finally, why do we have this policy? On the large scale, it's to advance science and improve human health. The policy provides access to research to the general public and researchers across different institutions, the idea being that since the research is funded by the public through their tax dollars, the public should be able to see the results of that research. It also provides the NIH a portfolio of work they can use to show Congress to demonstrate how their funding is being used. And furthermore, the policy was made law in 2009, and anyone who accepts funding from the NIH must comply. There are consequences for not complying, such as delayed funding, special conditions being placed on an award, or the prevention of future awards being granted for a specified time period. As of July 1, 2013, the NIH has enacted 2 changes to compliance with the public access policy. These changes affect all awards and renewals with a start date of July 1, 2013 or later. The first change is that the NIH is stepping up their efforts to enforce compliance and will now delay the processing of an award if there are non-compliant publications associated with that award. So, if you have publications that are not in compliance on your progress report, your funding could be suspended until you get those publications into compliance. The other change is that you will now have to use MyNCBI to enter publications onto your progress reports, either the electronic RPPR or the paper PHS 2590. We'll talk more about MyNCBI in the Managing Compliance with MyNCBI section of this tutorial. Just to summarize what we've discussed so far, if an article is peer-reviewed, accepted for publication in a journal on or after April 7, 2008, and is the result of NIH support, it must comply with the NIH Public Access Policy. It should be deposited into PubMed Central, not PubMed, to be made publicly available no later than 12 months after publication. For more information about the NIH Public Access Policy, visit the HSL's NIH Public Access Policy Guide or submit a question to the HSL using our Ask a Librarian service.